Okay, good morning.
Greta?
Yes.
Hi, Greta. It's Mary Lane. I'm just testing to make sure you can hear
Oh,
me.
thank you. I did want to test. So thank you. I'm going to mute you now.
Okay, thank you.
Actually, Marilyn, I can't seem to mute you, so can you just mute yourself?
You know I have a trouble with that, keeping quiet. No, will do. Thanks.
Okay, thank you. All right, good morning. Welcome to the June 15th Problem Gambling All Provider webinar. We have a pretty packed agenda today, but we're just going to go over some webinar etiquette if you're new to the webinar system. You are administratively muted today because we're recording this and we want to keep background noise to a minimum. And so if you have questions, you can type them in the chat section of the box that is on the right-hand side of your screen, and Roxanne or myself will respond to those, or we'll read them during our presentation and answer them verbally. So like I said, the chat section is in the box that's on the right-hand side of your screen, or should be on the right-hand side of your screen. And if that is blocking your view, you can minimize that screen by clicking on the orange arrow button. So here's our agenda for today. We're going to start with a presentation from Stacy Shaw from the Oregon Lottery. We're going to do some state updates. Then we're going to have a presentation about the respite services that we offer down in Josephine County by Jean Link and Marilyn Jorgensen. And then Roxanne Jones is going to do a presentation on some of the prevention data that we have gathered over the past year and a half or so, and then also talk about the positive cultural framework project that we're working on. And then we'll take questions after each of the presentations, but if you have just questions at the end, we'll do general questions if things come to you later. All right, so after the webinar is over, you will receive a PowerPoint presentation via email. You will receive this PowerPoint presentation along with the recording and any accompanying documents that we talk about, and you will get a CU certificate through the email. And we know that you are here and present with us because we can actually pull a roster sheet from this technology. So you don't need to worry about whether we know you're here because we're not doing a roll call. We are aware of that through the attendee list that pops up. Okay, so we're going to start with Stacy, and I'm going to unmute you, Stacy. But I'm also going to tell you, and I'm sorry that this technology is not going to be working really great today. We aren't going to be able to show your video because the sound doesn't come through our system, and weren't able to get IT to come in figure out why that is happening. We recently just got new computer systems, so we just last webinar figured out how to work the audio on your videos, and now we have new technology and we have to figure it out again, and we couldn't get any assistance in a timely manner before this presentation. So I'll run your ad and people can read it, but when I send it out to everybody, I'll include a link to the YouTube so that they can access it and listen to it on their own computers. So I apologize for that.
No worries.
Okay, so thank you for coming and speaking to us today. Take it away.
Yeah. Great. As Greta said, I'm Stacy Shaw. I'm the Director of Corporate Social Responsibility for the Oregon Lottery. And I wanted to update you on a few things that we've been working on in the ongoing implementation of our Responsible Gambling Code of Practice. So if you can take me to the next slide. Greta, oh, there we go. So as many of you may recall, the lottery beginning probably late December started to roll out a program by which we trained our video lottery retailers in responsible gambling, and it was called Responsible Gambling in You. And it was developed with an industry expert in training, plus our colleagues Greta and Roxanne and others, as well as with going out and working with retail staff. So as of me putting this PowerPoint together, we have trained over 4,000 retail staff at video lottery retailers, and that's just an extraordinarily large amount of retailers, and we're very pleased about it. We're not stopping. We are going to continue to train them on an ongoing basis, but we've gotten 4,000 thus far. Of those 4,000 retail staff, 6% have completed a post-training survey. And we found out a lot of good things about the training. We found that 82% of those who took the survey would recommend it to others. 90% said they know where to find information and what to do if a customer asks for help. 93% understand they have a role and what it is in the promotion of responsible gambling. And this number is particularly exciting. It's higher than we would have thought it would be, but 54% said they have greater job satisfaction because they know how to deal with situations as they occur. One of the things we found as we do training is that if you do training and then your manager never ever talks to you about it again, it doesn't really continue to resonate or really get enculturated. So 8 in 10 of the people who completed this survey reported having conversations with their managers following the training about the promotion of responsible gambling. So we were really glad to hear that. One of the retail chains that we have as a video lottery retailer told us they had a printed employee manual and they wanted to somehow put this training, which is an interactive online training, into their employee handbook. So we set about making a printed version of it, which is not interactive, but is still useful, a print version of it. And then we, as part of our multicultural outreach, we identified a resource known as, some of you probably work with them, ERCO. They can do translations for us very quickly, very inexpensively, and we can print really small amounts of these printed versions. So right now, we've got 7 languages for this training being completed right now as we speak. And this resource will enable us, to address anybody who needs it in any language, because we can do it quickly and inexpensively. So that's an update on what we're doing with our video lottery training. I know I've talked to a number of you about, that's great, what about the people who sell scratch-its and other things? So I'd like to move on to talk to you about what we're doing there. And the next slide, please. So right now we are working on a little mobile training. A 10-minute mobile training is currently being produced. It is for traditional lottery retailers, those who sell our scratch-it, draw game, and Keno product. And the focus of it is 6 things every retailer needs to know. Obviously, compliance things like verifying age, line of sight to our what we call our lottery goes, our vending product, and how that is a requirement. That there is available responsible gambling information. There's also game-specific information, how every game works, what the odds of winning are, the understanding how the games work so that you can make informed choices, problem gambling information. And we did some focus groups with traditional retailers, and a lot of the clerks had no idea that people could get free treatment that was professional and confidential for problem gambling. So we're really hitting that people to be aware that there is this really great treatment that is, effective and free. We're going to be piloting this later in the summer. We have identified 2 retail chains to pilot it with. We have Jackson's Foods, which is a convenience with gas chain, and they have 57 locations in Oregon. And then the multi-register grocery chain Safeway Albertsons has committed to being a pilot retailer with 94 locations. What we did when we did the training for the video lottery retailers, we started with some of our more engaged, high-profile chains, and then we rolled it out across the state. And we're taking that same approach here. And we're excited about it because on the traditional side, more of the retailers are part of a chain, and we'll be able to more quickly affect compliance on taking the training. And then, so we've also been training our lottery employees. So as some of you may recall, late last year, we had a 40-minute interactive online training that every lottery employee took. We had, obviously, because we have control over it, we had 100% of all employees take it. And we did surveys, and it proved to be useful. But one of the things we learned was that we have a group of employees who have pretty consistent and heavy interactions with our players and with retailers, and that they had some additional needs that weren't addressed by this training that we had the entire staff take. So we developed in-person 2-hour sessions for these folks. It was led by industry expert Janine Robinson, who's helped us develop all of our training. And topics included, having difficult conversations. These people are in retail locations on the phone with customers. Dealing with discouragement. Staff have expressed discouragement of seeing the same players and not being able to help them. And then self-care. People that work for the lottery sometimes deal with conflicting feelings about what we do and how we do it, and they are quite often called to task by players and or retailers, and we want them to be able to continue to do the good work they do and take care of themselves. We did 6 sessions of this, and we had staff from our field sales group, our player services, and those are the people who actually pay players. They see a lot of players. Our field, not our field, our field service folks who actually go into the locations and repair machines. So they deal with customers and retailers. Our promotion staff, which is out in public, interacting with the public all of the time. And hotline, which is a group of people who are on the phone dealing with problems that the retailers have. So we have a survey fielded on this one to see how useful it was and to help us inform our ongoing employee training strategy. And we'll give you updates on that at another call in the not too distant future. So we've also been doing quite a bit of new television around the awareness of help for gambling issues. We have a campaign right now called Signs, and it uses a unique approach. It's called kinetic type, wherein the message is both in audio but also appears on the screen in type. So we are running 400 TRPs, which is targeted rating points, and it's a lot, between June 5th and June 25th. We run advertising for the awareness of help all the time, but with this new campaign, we're doing it a little bit heavier. We have 4 15-second versions that are rotated about the signs that you might want to reach out. One is called Spinning Out of Control. One is Too Much Time. One is Significant Other, and Life Spinning, which is just like more about the effects on your life and your lifestyle. And Greta, did you say you're going to play it so people can read it, or just provide the link in the?
I'm going to do both. I'm going to play it right now because it's only 15 seconds, and
Right,
they can
okay.
read it. And then I will send out the link to. I'll actually find all 4 of those online, and I'll send out a link to all 4 of them so they can see all 4 different versions.
Okay. So you saw the type part of it, and when you get that, you'll be able to hear the voice too. And it's a really interesting approach to advertising because it works great in presentations like this when you don't have sound and you can still get the message, but it amplifies the message when you have both. So one of the things that we talk about every time we get together is what we call our trigger campaign. And our trigger campaign is search engine marketing largely that uses key phrase to make sure we're reaching people who might actually be interested in what we have to say. And over time, we've really increased the number of clicks that go to OPGR. And we work all the time to optimize that. What you're seeing here in front of you is a chart that graphs about a year's worth of activity. And there are seasonal peaks like everything else. In April, we had one of the highest months we ever had, but we ran quite a lot of media from March through April in support of Problem Gambling Awareness Month and beyond. And in May, we still had almost 300,000 clicks. So this is something that we've been doing for a couple of years, and it really continues to effectively use digital marketing to really make sure we have awareness out there, because we know that people come to help after multiple touches, and we want to always be around when people are ready to take an action. So that is what we're working on. And I think that's it, except for any questions anybody might have.
Yeah. Hi, Stacy. This is Roxanne. We had a question come in that was from your previous slide when you talked about the 4,000 trained so far statewide. Do you have a percentage of what that total number of staff, what that would relate to, or is that a number you're not able to pull?
We can't pull that. We don't know how much player-facing staff our retailers have. What I will tell you is that the first thing we did was do the training with the delis, and I'm doing air quotes, you can't see me, but everybody knows what that is, the Dotties and the Didis, where are high volume retailers. And we worked with them first because they're chains, and they have an average of 8 employees, most of them. Not all of them are player facing. And with those group, we got 5 per location. The average was 5 per location trained. So we were fairly sure we were getting most of the people. When you get beyond that, it's really hard to know when you're in a bar, and that. But we're working to increase the number of people per location. But we're right now averaging, if you put everything together, we're averaging training 1.9 people per location.
Great, thanks. And one other question came in, though I can answer this for you, is that the trigger data that Stacy just showed, we have that data by cities and towns on the Oregon PGS website, on the All Provider under the All Provider tab under Reports and Data. So you should be able to go in and look at the OPGR Google Analytic information that will give you, right now we have posted January through March, and then of 2017, but we have the trigger data, the hits, the Google Analytic data from both 2015 and 16 on there by cities and towns. So that information is available for you folks that would like to look at it. And that is all the questions we have at this time.
Well, as always, I'm always available for questions, so let me know, and thanks for listening.
Thank you, Stacy. Thanks for always making time to come and do a presentation on our webinars.
It's a pleasure.
All right, moving on. Okay, did I go? Okay, sorry. All right, so now I just want to do a few general updates about PGS stuff that's coming up. So we're currently having our provider meeting for June, but our next All Provider webinar will be September 21st. And you can find the registration link on the slide. You can also find it on the training calendar on Oregon pgs.org, and of course we'll always send out reminders about these in mid-August alerting you that they're coming up and to register. And just always remember that there's a training calendar on the Oregon PGS website that you can always see what's going to be going on in the near future. We have that calendar all updated for 2007 to the remainder of this year, 2017, and as far as we could go into registering webinars on our go-to meeting system. Okay, so I think everybody's aware that there's a national conference coming up on problem gambling in July here in Portland. So this is just a quick announcement to let you, if you aren't aware of that it is. And if you haven't registered, there is still time to register. So I provided you with the registration link if you're interested in needing to do that. Otherwise, I wanted to let everyone be aware that there are conference subsidies available if you're going to be attending the national conferences. Subsidies cover the cost, a portion of the cost of mileage and lodging. It does not cover the cost of registration for the national conference, but we can help assist with your mileage and your lodging. So remember that subsidies are intended to offset some of the costs, but not all of the costs, so we don't cover full cost. So either your agency has to cover the remainder of that cost, or you would have to cover it yourself. So if you're interested in receiving a conference subsidy or applying for one, you must do so by July 1st. And you must pay for all the costs up front, and then you will receive the approved subsidy request via a check at the conference. You'll be found, and that check will be handed to you. So if you need that form or more information, please send me an email and let me know that you're interested. Otherwise, I just wanted to let everyone once again be aware of the online trainings that we have created for our system. So this was a very huge project, so we're hoping for a lot of use and that a lot of people will use these modules and to get their continuing education CEUs for their certifications, or we're also hoping that you will promote these among those that you work with for them to have a better understanding of problem gambling. They can also receive CEUs for their substance abuse certifications and maybe some of their mental health licensings. So these modules are, there's 8 modules total for a total of 10 CU hours. Each module is about an hour to 90 minutes long. If you go to the link, it will lay out all the different modules for you, and it will actually tell you which modules are appropriate for what population. So some of the modules are good for prevention coordinators and specialists in your communities to get a better understanding of the problem gambling treatment system, or just a better understanding of what problem gamblers or their families are dealing with when they have this disorder. So we highly encourage those that are on the treatment side and the prevention side to go to this website, register. If you're in need of CEUs, it's a great place to go. Registration takes about a day for you to get into the system. And once you're in, you can watch any of these modules when you want to. And like I said, within that first homepage, it will tell you which modules are most appropriate for what population. Also, I wanted to let you know that Lewis and Clark is once again offering their Gambling Counselor Pre-Certification Part 1 course. This is a 30-hour course. It is part classroom and part online modules. So we really highly recommend that all of our treatment providers take this course. And it helps them with, it provides the hours that are half the hours that are necessary for certification. And we also encourage prevention people to take this course also, especially if they're interested in learning more about the problem gambling system as a whole. And we feel that a lot of times understanding that system and what treatment really entails can help prevention also do to do their job even better. So if you're interested in that, please register. As you see, the course does start on September 16th. I also wanted to let everyone know that we have been, since we're going to be starting a new biennium, We have updated a lot of our contracts and executing those. So we went in and we really looked at our helpline contract this go around, and we looked at what was out of date, what was working, what isn't working, and I just wanted to inform you that we have a few new things that are going to be occurring this coming biennium. First off is that we're going to in the past, we used to have a second backup to our specialists that answer the phones on the weekends and the holidays, and we had to take that away due to some budget cuts a few years back, but we're going to add that back. So we're going to add a second backup specialist that will be available for after hours, weekends, and holidays. So instead of being put on hold, if the first specialist is taking a call, now a person, two people can be receiving helpline services at the same time during those off-hour times. Additionally, we are going to be adding a new feature, which is called a motivational text messaging program. So this program, you would sign up through the helpline, and it's for gamblers, family members, and it's available in English and in Spanish. It provides those that sign up 2 texts a week for 3 months. And what it does is it provides motivational texts to help, depending on what stage you are in your treatment or seeking services, depends on the text message that you receive. So if you're just engaging in services, then it's just motivating you to stay engaged, understanding that you're in the first new phases of hopefully being in non-gambling or in harm reduction. So it designs the text messages around where the people stages of change are. So we will be implementing this later this summer, and when it is up and running, I'll let you all know in case you want to sign up for it yourself, or if you want to have current clients in treatment sign up for it, as it will, once it is implemented, it will be offered to any of those in the public that contact the helpline for services. It will be an additional service that is offered. And so we want to make sure that those that get into treatment directly to your agencies, not just through the helpline, also have this available. So we'll design some way to promote that, so you can promote that to all of the clients that you see in case they get missed through the helpline. Lastly, we're going to be implementing an OPGR Facebook page. One of the reasons we're doing this is because we have a lot of advertisement that is on Facebook right now, and in order to advertise on Facebook, you have to have a business Facebook page, and we didn't have one, so all of our advertisements are linked to the Oregon Lottery logo, and that is fine. However, we know that sometimes that can discourage people from contacting us. So we wanted to try to get our OPGR logo attached to our actual ads and different things that we have on Facebook, and see if that might help increase the links or the clicks or the calls that we get to our to our helpline services. So we will be having an Emergence, who is our helpline contractor, a staff person maintaining that Facebook page, and also putting up messages every once in a while, and then responding to messages that are appropriate to respond to. So other additional services may be considered in the future, but they're being in process and still researched, but right now that's what we're going to be implementing later this summer. So stay tuned, because as they roll out, you'll be hearing about those. We also wanted to let you know that we have a contract for infographics to be developed. So we have developed a few infographics that we've finalized, and they are available on the Oregon PGS web page under the Media tab. One of them is infographic, a two-pager on older adults, and the other one is it's a one-page, like JPEG kind of looking thing that you could use in slides, or you could put on a material that you created, and it's around the co-occurrence of gambling with other risky behaviors. So it's taken from the data that we receive from the clients that we serve. So those are available on the Oregon PGS website. if you are interested in using those, they were created so that you could incorporate them into your materials or your presentations or however you want to use them. I believe, and Roxanne can correct me if I'm wrong, the older adult one has numerous facts within it, but you can pull certain sections of that document. If you're interested in only one section of it, you can pull a section and you can insert it into something else. All right, so now I'm going to turn it over to Roxanne for her prevention state updates.
Great, thank you, Greta. And yeah, with the design of the infographics, the intent is that you should be able to select portions of the infographic, either using copy and paste or your snipping tools, to be able to insert different pieces of the infographic into a document if you so choose. So, and also just to kind of follow up, I know that we did have a question in regards to the links when we send out the PowerPoint. Often aren't accessible, so we will send out the link again for the prevention trainings that the series that Greta had mentioned, so we'll get that out to everyone as well. So as far as state prevention updates,
Roxanne, just really quickly, sorry, I also forgot to mention on the infographics that those are the 2 infographics that we have had created. We're in the process of also creating other ones that are specific to our client data that we receive from our evaluation reports from Herbert and Lewis. And also I'll let you talk about the ones that will be created in the future around prevention data.
Right. Yeah, and so in regards to the prevention data infographic piece, we are looking at the data that we will be having from our adolescent prevalence study that we should have a report out within the next couple of months, and then looking at data that we have through the Student Wellness Survey and Oregon Healthy Teen, and wanting also to develop tools that will be good for parents for having the conversation, as well as teachers, et cetera. So that is our plan in the next biennium, to really look at those infographics and work on those. So more to come with infographics, and really wanting to create tools that you all will be able to use in your work. Also being able to tag those onto your email, under your signature line, et cetera, so that you can just be sharing information on a regular basis. So thanks, Greta, for that reminder there. So for the 2017-19 biennium, the problem gambling prevention plans are due on or before. Emphasis on or before. We're happy to have them come in before June 30th, submitted in the Oregon Prevention Data System. If you're needing assistance with your plan development, please contact me. Or there's also tools on the OregonPGS.org site where we recorded a training on entering your plan in the system, as well as the flow chart for OPDS, and guidance tools are there for you to utilize in developing your plan. But I am happy to assist with questions on the plan. The reminder that the Problem Gambling Prevention 2016 through 17 annual reports are due on or before August 15th. And that report form can be found at the Oregon PGS website under the Prevention tab for reporting and tools. But we will also be sending that out again for folks so that you can submit your annual report. The Problem Gambling Prevention Advisory Committee has been meeting monthly, and we're looking at and reviewing documents that impact problem gambling prevention. And our project that we are currently looking at is we are looking at the Substance Abuse Prevention Coordinator Manual that has been created through our office here in the past, and editing that manual to create the Problem Gambling Prevention Coordinator Manual. We want that manual to be something that will be posted online, and that new coordinators as well as existing coordinators can pull up that manual and have information that will help guide them in their position as a prevention coordinator, and be a real tool to help support the field. So hopefully by this fall, we will have that manual ready to be posted online. And we'll send it out as a link as well as a PDF document so that you have that that information for the work. So we're excited to move that forward. It will include things all the way from roles and responsibilities of the coordinator, as well as the information in regards to the CSAP strategies, IOM categories that are now the behavioral health continuum of care. And so excited to get that out to you guys. So more to come about that. The other component that the Prevention Advisory Committee will now be serving as they will also be the Workforce Development Committee for Prevention. So helping us guide what trainings and information that we have out there to develop the problem gambling prevention workforce. So I will share again with folks who all is on that committee. So if you have specific things you would like to make sure that they're aware of and to bring forward, they can do that for you, or you can send that information to me, but we'll send out a follow-up email again to the prevention folks who's on the advisory committee. So next slide.
Okay, so that was it for prevention thus far. Did we have any questions?
Not seeing any questions for prevention.
Okay.
Thanks, Greta.
Thank you. All right, so now I'll just go quickly over some treatment information, related information. So just as a quick reminder, because I keep talking about this, that we do have these family therapy learning sessions and forums. So this is information about them. We have 2 more scheduled for the rest of this calendar year, July 27th and October 26th. So if you're interested in those, you might want to put those on your calendar to hold your time for them. We also have an advanced family and problem gambling treatment discussions, and we have 2 more of those webinars calls coming up on September 7th and November 30th. So once again, if you're interested in those, I would put another hold on your calendar just to keep your time as free and open as possible. Information on all of those come out a little bit prior to when they actually occur, login instructions and reading assignments that are readings that are attached to them, or at least attached to the family session one. Also, just wanted to let you know that we have an August treatment call on Wednesday, August 2nd. So we don't have any treatment calls in July for prevention or for, so we didn't have any treatment calls in June for prevention or for treatment, and we don't have any because of this all provider webinar, and then we don't have any treatment calls in July for prevention or treatment because of the national conference that's occurring. So we'll be starting up again in August, having our treatment call. So the next treatment call is going to be August 2nd, and more information will come out about that when the date gets closer. So I wanted to just let you know a little bit about some changes that are happening for the upcoming biennium that starts July 1st. So we have added some procedure codes to our procedure codes and rates document. We, as you are well aware, we have a flex code that is currently that we use within our system, and you encounter to that the actual amount of the service that was provided or what purchase you had made. And when you submit that information to Herbert and Lewis, sometimes people will code what it is for. So just to get a little bit more specific on where our flex code funds are going, we have created some subsets of this flex code, 6 different sets. So we now have a specific flex code for professional staff development when you're traveling and going to trainings, and the cost that is accruing to your that's coming out of your allocation for problem gambling services. We have a flex code for transportation. This is client travels transportation, not your as a clinician transportation, because transportation for you as a clinician, if you're going to someplace to do client find outreach, or you're going to see a client at their own location, actually has its own mileage code. So this is actually client transportation to your services, so that if they have a barrier for transportation, we have a code now for what we call community social engagement. And at times there's a need to get our clients more actively involved in our community, and you can, if your budget allows, use those funds to help them get started in a particular alternative activity away from their gambling. We have an overall well-being flex code. We have seen this being used where eyeglasses may be purchased for a client because they are having difficulty reading handouts and materials at your within your sessions, or they're trying to seek employment but they do not have proper attire or something like that. You could use your funds, so that would help their overall well-being and help them advance. There is a flex code for nutrition for events, so this would be food and beverages. Sometimes we know that is really important to have these types of things at your activities that you're doing, client finding activities, or just sometimes at your group sessions. And then there's one for temporary housing, which should be used with caution, but it is there for helping people get into their housing when they are not able to get the full amount of fees or funds put together, and it risks them from receiving their housing and becoming homeless. So these are all codes that we allow you to use your discretion with, and we know that you are always aware of this situation about giving. We don't give money to our clients, but also giving them opportunities like this. Some of these opportunities, like covering their transportation, community engagement, or housing, or their well-being, that we need to always be cautious of our enabling of our clients, making sure that that really is for their best good, and that we're not just compensating and covering for funds that they would then have used for their gambling. So the new procedure code and rate sheet will probably be sent to you later today, so you'll see those codes there. And you can also use the general flex code too when none of the categories that are broken out apply. You can just always code your stuff to flex, and just like we have in the past. Also wanted you to know that for our procedure and rates document, we have increased our rates for this coming biennium. We worked with our actuarial services unit here at OHA to determine if our problem gambling rates how they compared to other rates, those of the Medicaid system, fee-for-service system, and the CCOs across the state. So it was determined by the actuarial services that our rates were a bit low. Some of our rates were a bit low, and they made a recommendation to us that we should increase our rates by 11%. And so we looked at the budget and determined that we could do that. And when I say I looked at the budget, I also looked at the encountering of treatment programs over the past year to determine what they encounter for versus what is their allocation, and if this allocation was to increase by 11%, or if this encountering would to increase by 11%, would their allocation still cover those services. So it was determined that most of the programs would still be covered under their current allotment. And so it does not mean because we increased the rates that you have received an increase in your treatment services funds. It just means that when the data comes in now, it means that those that are receiving a fee-for-service through their system, whether they're a subcontractor, then they may receive a higher reimbursement rate. It means at a statewide level, our expenditure rate will increase, and it will give an appearance that we are using a greater level of our funds to treat clients, which is good because we were low, and we should be of a similar level of the other systems. So this is a really good thing that's moving us forward. And I just wanted you to be aware of that. And if you have any questions or concerns, please feel free to contact me. And please know that we do here at the state monitor encounters through those that are the information that's submitted through Herbert and Lewis on a monthly basis. And we do ensure that if a program is getting close to overspending the allotment that they received, or it looks to be that they will if they continue at the same pace, then we check in with Herbert and Lewis and look at what the data is showing, and then we will typically contact the agencies to let them know that we will amend their contract. If our budget allows us with additional funds, we will amend our contracts and provide you with more funding, or we will have a conversation with you about how can we stay within the funding allocation that we have and still continue to provide services. I also wanted to let you know that we have been having some collaboration with the criminal justice system at the statewide level. Our state office has been working with the Department of Correction intake administrators at Coffee Creek Correctional Institute. That is where all of the potential inmates first are sent to before it's decided which actual Department of Corrections prison system they're going to go to. So our want when talking to them was for an assessment or a screening to be completed for all those entering the DOC system at intake, a screening for problem gambling. And DOC was very open to that. However, their suggestion was that at first that we would determine what the actual need was. We know from the data that, the national data, that usually what you'll read is that problem gambling within the criminal justice system is 3 times higher than the general population, but we don't have any actual data here in Oregon. So we took that recommendation and we developed a screening tool, and we are going to be implementing that screening tool starting August 1st for 6 months, and it'll provide us with data to really show us what the need for problem gambling services within the Department of Corrections and the criminal justice system is here in Oregon. So just for your information, because I had no idea about this, but approximately there are 450 intakes a month through the Department of Corrections system. 60 of those are women, and so we were going to implement this project for 3 months, and then that would have given us about a $1,500 or a 1,500 person survey would have given us a sample size. However, the women's size would have been much smaller, so they actually encouraged us to do it for 6 months so that the survey sample of women would be higher. So we are really developing quite a great relationship with the Department of Corrections and those that we're currently working with, and we're very excited about it. So we will have some results in the near future, and so just stay tuned. Also wanted to let you know that we are going to be forming 2 new advisory committees this upcoming fiscal year. One is going to be called the Treatment Workforce Development Advisory Committee, and the other one's going to be called Rural Services Advisory Committee. So the Workforce Development will help develop a training plan and spending of our workforce development budget. And the Rural Services, I don't have a lot of information on what this is going to look like, but it's supposed to help us develop a better system to support rural services and communities. So right now we know we have a large struggle with rural services for problem gambling, so we want to look at what could we do differently and how could we structure our system differently to support those services. At this time, I'm not sure if, and I know that struggle occurs on the prevention side and the treatment side. At this point, I'm not sure if we're going to combine this advisory committee together or have the discussion separately between prevention and treatment, and then maybe bring it together at some point. So these are all really new in the development, so it hasn't all been completely thought through yet. I just wanted to give you a heads up that these 2 advisory committees are coming down the pike, and if you think you might be interested in participating, we will be having some emails coming out about signing up for them, what the obligations and the specifics of these committees will be. And then lastly, I just wanted to let you know that we are in the works to contract with Christopher Anderson in the fall of 2017. Christopher Anderson is the speaker who came to our fall 2016 conference. He is going to be conducting webinar supervision sessions once a month for 90 minutes. So we know that in our treatment system, one of the hardships is that many times our clinical supervisors don't have a real background in problem gambling and the issues that our clients can present that are different than substance abuse and mental health clients. So this is an opportunity for our clinicians to talk to somebody with that specific knowledge and experience, and we can't talk about current client cases, but we can talk about case studies and how to approach them and different things like that. So stay tuned as more information comes out about this, but we're hoping to start this sometime in the fall, and we'll get all those dates preset so that you can get those on your calendars. All right, that's all for the treatment. Is there any questions, Roxanne?
Hi, Greta. Wanting to kind of go back to the tech support that will be new happening through the helpline. We had a question about what will the registration process look like for that?
That's a good question. I believe it's a pretty simple registration process where the helpline staff will be collecting a little tiny bit of information from the caller that's interested, and then they'll get signed up because I think the only thing that they really have to provide is their phone number and their name. So it's very small little bit of information. It should be a very simple process.
Okay.
I don't know if I answered that or not, but.
Okay, and so just on the, we did have a question about the infographics and whether they're not currently showing up on the website. And we did ask that those be posted yesterday, but we don't have confirmation yet that the infographics are up. And I just checked and they're not currently there, but when they will be there, once they're posted, they'll be under the media tab, and they will have their own tab within that tab that will say infographics. But I think our web poster was out yesterday afternoon after I sent the email to ask them to be posted. So those will be there soon, and so just keep checking back, but they'll be under the media tab. And that is all the questions we have right now.
Yeah, so apologize for not having a web link to the infographics, but when we do send out the PowerPoint and follow up to this webinar, we'll include in the email the links to the lottery ad, the links to the online training, and then also the links to the infographics for you. Okay, so now we're going to move forward, and we have a presentation about respite services. So I'm going to unmute Marilyn and Jean, and just let me know when you want me to advance slides and move forward.
Hi, Greta. Hi, everybody. This is Jean.
Good morning, everybody. This is Mary Lane.
All right. For a number of years, we've had respite services for problem gamblers and tried to get the word out, but we feel like our services are underutilized. So we would like to talk about those services and how to access them today. And at the end, we'll have our contact information. So Greta, I think you can go ahead and start okay, there we go. So this gives an explanation of what our services can do for your clients. And it's not only to stabilize them in order to return to you and do outpatient, but we hope that people will use the service to prepare people for residential treatment. And I'll give you just a moment to read the screen, and then we could advance that. Mary Lane, jump in anytime you want to.
Okay. Well, I think the one thing that I want to stress here is that this is geared towards just the brief intervention for stabilization, and then to be able to refer the individual to the next most appropriate level of care.
Okay. So the staff at the CRC, most of the staff, or a good portion of the staff, are KDACs, and as you see in the list here, we have access to a psychiatrist, nurses, QMHPs, and I currently am the only person with a gambling certification stationed at the CRC, but we try to keep have a close relationship with the KDACs to keep them in the loop with what word am I looking for screening and being comfortable having those conversations with people with co-occurring disorders. And as Mary Lane said, this is a brief, so as you'll see on the screen, it says average length of stay is usually 5 to 7 days. We don't always tell the clients that, because then they kind of hone in on that as like, I am here for 5 to 7 days, and it may be 3 and it may be 9. So we kind of keep that out of the part that we share with them or ask you to share with them. So if there's no questions, we'll go to the next screen.
Hi, Jean. This is Roxanne. We had a question. Can the respite services accommodate clients that are with Spanish as their primary language?
Good question. I'm sure we could get an interpreter. Mary Lane, what is your response to that?
Well, we do have availability to get interpreters through the agency, so we would do our level best to make that happen.
I don't know that we have anyone on staff that speaks Spanish that I recall at this moment. Not someone placed at right at the CRC, but yeah, I'm sure we would make every effort to accommodate the person. So eligibility, 18 years or older, assessed and referred by a qualified professional. Most of the time that is one of our problem gambling counselors in the state. We ask that people be screened by a physician because we need that. That's just something that CRC has to have because of our certification. And meet the criteria and be placed on either physician's or director's hold. I don't know that that is an absolute, correct, Mary Lane? But that's one of
well, for the if they're in the non-hospital hold, it would be they would need to be, yeah, and they can be transported by secure transport. So if they're out of county, usually the health plans will cover secure transport to get them here safely. And the part about being screened by a physician, that anybody that's admitted does need medical clearance to come in due to our administrative rules.
And this is a form that we fax as part of our intake packet that we just ask people to take to their doctor or to their ER, and it's to screen out people that may have needs that we can't take care of, or you know, perhaps they can't get out of the building in the time required by our fire code and stuff. So to go back to what Mary Lane was saying, this is the section of the CRC for the non-hospital hold. So we do have 2 different units there. So we have a capability of having people that are a lower level of care too on the respite side of the building. So next screen, please. Okay. These are people that we don't admit to the CRC, even from our community. This is not just for problem gamblers, but there are just things that some guidelines that we have, and these are folks that we're unable to take care of. We don't do
well, and I want to back up a little bit too to the medical clearance. Another thing with that is, with people that are experiencing some kind of a psychiatric disorder, we want to make sure that what we're looking at is a psychiatric disorder and not a medical condition. So that's another reason why we do that.
Right.
Okay. Thank you.
All right. Next screen. If there's no questions. Okay, and this is the actual respite unit for people that are a little lower level of care, 18 years of older, ambulatory, referred from another treatment program. And we really like to connect, even if a person is in a hospital somewhere, we really like to get the clinician from the gambling program in that county connected, because we really like to be able to refer back to the gambling program. So often when I've gotten a call from a hospital, I will try to connect to that county's program to get them involved. And lastly, meet the DSM-5 criteria for gambling disorder. And our RN CRC supervisor, Eric Dominger, is, even though I'm highly involved in doing the intake there, Eric is actually the one that has to do the final acceptance, review the forms that come in to make sure that the person meets all the criteria for safety. Any questions? Okay, this gives a good idea of the type of client you may have in your office or in your local hospital ED or hold room that you can consider sending to the CRC or our hold. Are there any questions about what any of these might encompass?
Not seeing any questions at this time.
Okay, we can go to the next. We strive to work with the referring clinician to identify goals and objectives, which may include the following. Like I said earlier, we do have a varied staff that are available to, and we are, of course, a 24-hour facility, so we have many of these clinicians available about 16 to 18 hours a day, have less staff overnight, but they are capable of identifying and treating co-occurring disorders, so that when they go back to their home or to Bridgeway, they, have some a clearer diagnosis. Often when they return, we really want to stabilize and engage that individual. One of the things that we hope for is that if a person can come to the CRC for a short time before going to Bridgeway, that they're more prepared to engage in treatment, so there's not a time loss there by the time they get there. And because we know that people go through withdrawal and they need some psychiatric stability and perhaps medication change, so all of that can already be taking place before a person is accepted into Bridgeway, and it makes that transition nice, and it makes the utilization of their time at Bridgeway much more effective. So these factors here that I've listed are helpful in doing that. So any questions? If not, we can move on.
None at this time.
I covered some of this already. One of the things I haven't mentioned is that we really do like to connect people with our GA folks. We have the GA meeting on site 3 times a week, and we do take people out to local AA and NA meetings almost daily. So we do get people connected with those, and many times people have not had that opportunity yet or taken that step. And so this is something that we've often seen people go away with a good experience with their connection with GA, and we hope that when they return home, they'll feel more comfortable in using that as one of their supports.
And I would like to add to that too, for the folks, that our GA community has just done a remarkable job at reaching out to these individuals and welcoming them and giving them a very positive experience, which we are very grateful for them. And we are really fortunate to have the meetings right there on the campus where the CRC is.
Okay, next screen. Okay, so as I mentioned earlier, Eric gives final approval, but these are the contacts. I'm only here part of the week, and I do work closely with the clinicians on the CRC campus. And so you may, I don't want, I would hope that a person wouldn't get frustrated by feeling like you're being passed around, but it could occur. Say, I often get calls at the end of the week, and I'm going to have to hand off the process to these folks you see here in the left column, and they're going to be making the final decision anyway. But I will be the person that works closely with them on a daily basis on the days that I'm here, along with the KDACs. So you can feel comfortable in calling any of the people on this list. And Greta, you did say this was going to be shared, correct? Everyone will have this information?
Correct.
Okay.
And I also have your, you had drafted a nice little, like, I can't remember what I called it, but a little overview of your services, and it's in a one-pager, and I can send that out too because it's easy to read, very easy to read.
All right.
Thank you.
Next screen. So I think this is the conclusion. We really do get excited. We love to hear from other counties and get this opportunity to work with people. So, in fact, I just got a call this week asking from a clinician asking about our services if they still were in effect. So, yeah, give us a call. We love what we do and would love to work with you.
And I want to just touch base on one more thing. I think on one of the advantages of this respite program is that if you're working with individuals that have not previously had a mental health assessment, but they, may have been experiencing some mental health symptoms, this would be an opportunity for them to get that, to tease out that co-occurring disorder, and again to begin treatment for all of these disorders concurrently, which I think we're all in agreement on is the ideal when we're working with folks with co-occurring disorders. So I think that that's a real positive that this program can offer folks.
Correct, and we would encourage you to, in the paperwork, it does ask for you to identify goals for the client. And, one of the things that we can do besides offering some psychiatric evaluations is a person can come here and participate in an ASAM if they haven't had one completed yet. So that's entirely possible. Or, we can assess the level of their problem gambling diagnosis.
One of the other
Sometimes when people have come here, they haven't even considered Bridgeway yet, and that is something that we try to motivate them towards, evaluate, whether that's something that they're willing to do, whether they're able to do. Sometimes jobs get in the way and such, but we have seen people make that decision while they're here to go on to another level of care.
The other thing that people may see as a barrier when you're in different parts of our state is the transportation aspect of it. And I would just like to encourage all of you on the call to get a hold of Jean and talk with her on that and see how we can help facilitate that or just problem solve that. Just don't let that be a barrier, because many times I think we've been able to work that out in different ways that have ended real positively.
That's true.
Great. Well, let's see. Roxanne, is there any questions for Marilyn or Jean?
No, we do not have any questions at this time.
Well, thank you too for presenting. I think it's really important that we talk about this particular service to let people know that we have respite service and that it is being underutilized, because it could be an important step if your client is if there's a waiting list at Bridgeway, or if your client's just not ready to go to Bridgeway, or if they do develop a crisis and need to get out of their community. So I'm glad that you could come and present today, and I think we'll just have to figure out how to just keep the conversation going about these services so that people keep them in mind.
Well, thank you. We sure appreciate the opportunity, Greta.
Thank you.
Absolutely, thanks.
Okay, so we have about 15 minutes till the end of our call, and so I'm going to pass it over to Roxanne for her to talk about her updates around the prevention data and the project that we're working on.
Great, thanks, Greta. And so just a caveat before I get started here is that the prevention data spotlight, this is going to go back to I did not read my assignment here. The data spotlight will add into the September all provider meeting so that we can highlight the information that's coming out of the adolescent prevalence study, as well as some of the additional data that we've had cross-tabulated with public health around nutrition, et cetera. But so won't be part of today, but we will be going into the Positive Cultural Framework Project Phase 1 update, so my apologies there. But anyway, next slide, Greta. So, and go ahead and hit next slide. So basically, the Positive Cultural Framework Project is a project that we have undertaken with Montana State University to really look at how can we have using the Positive Cultural Framework as an approach, improve the health and safety in our communities, as well as the organizations that are working with us in problem gambling services. So really looking at using the positive community norm framework and recognizing that there are different layers in the community that impacts the culture that's happening for all of us across the state. So again, this is a partnership with the Center for Health and Safety Culture at Montana State University, and our primary goal is to develop a communication campaign to reduce and prevent problem gambling across the state of Oregon. And the real goal is that we really want to build upon a core assumption that positive exists and it's worth growing, that we want to build this. And often when we talk about preventing something, sometimes our message can get conveyed as getting people not to do something, which can take the energy away. So we really want to develop and embrace a positive, hope-based framework, which will not only help to draw our youth in to do making positive choices about the activities they're engaging in, but our adults, and then working with our key stakeholders as well across the state. So next slide, please. So this project currently is under a 6-month planning grant. So it's really more around planning and doing assessment and really utilizing the positive cultural framework process of really looking at all the different steps with keeping the socioecology at the center of all of this, but really looking at planning and advocating, assessing the culture. So looking at what is the culture here in the state of Oregon. And so developing our goal statement, which was really around reducing and preventing problem gambling here in the state of Oregon. We have a timeline that was for the 6 months, looked at who our stakeholders are and the capacity building piece. We did do a strategy map of the state of Oregon, really looking at a high level view of not only what's happening prevention wise, but also treatment and recovery. And then our next step was really looking at a campaign theme and just developing a strategy portfolio, so campaign recommendations, which we will have at the end of this this project here, which ends June 30th. Another piece of what we're looking at is developing a logo and a brand and having that tested, and then implementing that out statewide, and then evaluating this. So really just aligning our project with the steps that are part of the positive cultural framework. So next slide, please. So when we really look at what this is going to look like statewide, really are looking at, it's a simplified behavioral model, looking at the values and the attitudes and beliefs being the cultural factors that are shared that are going to impact the health and safety in our community. Then really looking at the willingness and intentions that people here in Oregon have and trying to impact the behavior. So we'll be taking what we're learning about the values, attitudes, and beliefs of not only adults, but also adolescents that we can pull from our adolescent prevalence study, and then moving forward into a campaign to really try to impact the behavior here in the state of Oregon in a positive way. So next slide, please, Greta. So again, this is the social ecological model. So really looking at the components that make that up of really the individual, the family, and the peer, knowing we have things that happen in school and the workplace, and then the community. So it's really just really trying to look at this as the culture that impacts across all of those domains, and developing a campaign that will address that. So next slide, please. So really where we're at is we're trying to transform our approach about how we're doing our work here. You know, before it's always been, how do we get individuals not to engage in those risky gambling behaviors? How can we stop that? And what we're really looking now is what actions can we grow across the social ecological domains, so the individual, the family, the peer, what's happening at the school and the workforce, and at the community at large, to reduce problem gambling. So how can we make these steps really become more ingrained into the culture that's happening, that we know that is happening for all of our communities. So next slide, please. So the real importance of this whole campaign and what we're looking at, and for the prevention people on the line have probably heard me say this more than once, is that we certainly want to make sure that we're letting people know that gambling can be an activity that carries risk for some and develop problems, but always letting them know that there's hope, and our hope out there is the message around treatment and recovery, etc. So this was just a great quote that came out around about hope, that it's the momentum that change requires large amounts of positive effect and social bonding, etc. So again, just really looking at how can we increase hope in our communities, not just within the folks who are impacted, or not, I'm sorry, who are having a problem with gambling, but the other folks that that are in their lives that are impacted by that as well. So next slide, please, Greta. The other piece is that we know that we really need to be looking at and talking about concern, but again, going back to that whole piece about raising hope. So we essentially, we have to tell them about the dangers that are there, but we also have to empower them with a sense of hope to make change. And so, again, looking at our messaging and how we do that in prevention as well as through treatment, how can we make sure that we're raising concern, but also hope? Next slide, please, Greta. So again, you know, often there's that whole piece about when we're raising concern, are we also are we tackling fear? And I think that the big piece is about how can we have these messages really come from a concern base versus fear. Many of times in the past, as prevention has grown, fear tactics were a way that we got our message across, and really we're wanting to not utilize fear as much as getting out there that concern is there. I mean, fear is really going to have that unpleasant emotional response for people is dangerous and it's a threat, where concern's going to really allow people to move forward. At the same time, it means we care and that we're accepting responsibility. So that's where we want our messages to come from, is a place of really caring and accepting responsibility. And it doesn't mean that sometimes fear can't appeal and be a very effective way of getting people's attention, but research has shown that it's very, very much challenged whether or not it actually can change behavior. So that brings us back to really looking at the positive approaches to help seek and build and grow upon what is really working at for our people, and it can be much more attractive versus pushing them away into something that an activity or a behavior that we might not want them to engage in. So next slide, please, Greta. So, we know here in Oregon that, we do have the concerns, and we reframe them as concerns, is that problem gambling is a public health concern. We know that. We know that the concern for us is that more than 81,000 Oregon adults are believed to meet the criteria for being a current problem or disordered gambler. So we have a portion of our population this is impacting, and we know how that also will impact beyond just the individual. We're talking about the spouses, the children, the individuals, the neighbors that are impacted by that, as well as within your work. So next slide, please. So that that goes back to also the social cost. So a concern for us here in Oregon is that the social cost of someone's gambling getting out of control is in excess of over $500 million. It impacts our criminal justice system through whether folks have been engaging in criminal behaviors, the legal system for bankruptcy, the divorce, the loss of relationships that occur, impacts our Oregon the economic health, and then the human service system as well. So there is a large cost to Oregon when to our state with a social cost, and that's a concern. Next slide, please. When we look at our youth, we know that we also are concerned, and we look at the data that's coming out around just as a point here, our Oregon 11th graders, those who report gambling have also had higher rates of skipping school, being in physical fights, being sad for more than two weeks, the use of alcohol, marijuana, and other drugs. We also are seeing some data that also shows that those youth are experiencing food insecurities, that the bullying piece, a component of that. So it does raise our concern that we know that our youth that are engaging in gambling behaviors are also engaged in other risky behaviors at a higher percentage than they are if they aren't reporting that they're gambling. But also, we're looking at the data that shows us that over 64% of our 11th graders stated that their parents have not talked to them about the risk of gambling or betting. So we know that our youth are getting closer to graduation and moving on into their adult lives, and they're not hearing from their parents or their caregivers about that their gambling is an activity that carries risk. So we know we need that as a concern, and we need to do something to help address that. So next slide. But there is hope. We know that 43% of our Oregon adults have not gambled in the past year. Again, 68% of 11th graders did not gamble in the last 30 days. So we know it's not that all of our youth are out there gambling. And Oregon adults believe that the harm associated with gambling outweighs the benefits. So these are all things coming from our prevalence study. So next slide. Again, there's additional data here that also gives us hope, that shows us that we have a system in place that adults are aware that that gambling can be prevented through education and awareness, and that the percentage of adults that are impacted is less than 3%. So next slide. So again, those are just examples of how we can look at the hope and the concern component of that. This is the last stage of our planning project, is developing the logo and brand testing. So we have this logo and brand is out being tested by over 300 individuals through a study, as well as our prevention providers have been have had the opportunity to look at this and review. And so these are the two different places we're looking at with our brand and our logo. And really having the reflect, the resource, and renew messages be impactful not only for the bystander, so those individuals who could be the family or the loved ones, but also people who have a problem with gambling. So looking at those bottom messages is really where it changes up, where the three steps to address concern about gambling, or the 3 steps to address problem gambling. So looking at what one of those messages plays better in the group of folks that will be reviewing this. So once we have those finalized, we'll be able to finalize our brand and logo testing. And next slide, please, Greta. Be looking at phase 2, which would be how do we take this information we have, the brand and the logo, and a communication plan, and look at how can we roll this out with our providers who are interested in utilizing the materials that can be created, whether they be radio ads, print ads, billboards, etc., and use this across the state. But that will be phase 2 that will be kicking off in July. So that is that for our update on the project. Wanted to make sure that both prevention and treatment were aware that we're undertaking this, and they will start seeing some of this stuff happening out in the next biennium. So are there any questions? I know that we're right at time, so.
I don't see any questions that were posed to you. That was a fabulous presentation. It answered everybody's questions, and it was very informative. This has been a very this webinar was very full, and so we appreciate you guys hanging on through all of it, but we did make it through the whole thing, so that's great. And in respect of time, because it is 10:31, I am going to say thank you for attending today. Information about this webinar will come through to you later this week. And if you have any questions, you know how to reach us. Otherwise, I'm going to let you go for the day, and have a great rest of the day and have a great rest of the week. And we will all see you later this summer.